Okay, hard part is over. So now let's talk about how to take care of these grafts for the next little while. Now we're going to be going over the post-op with you in detail before you leave, so you don't have to try to memorize everything that's on this video. We're just kind of briefly going over what you can expect for tonight. One of the things that you're going to get at your post-op is a kit bag like this. And in your kit, you're going to have something like a spray bottle, like this. Beautiful prime hat, like this here. A headband similar to this, some medication. Typically for pain, you're going to get about 10 tablets of Tylenol 3. You are going to get a prednisone and something for swelling, so an anti-inflammatory, and typically an antibiotic like Keflex. Now, if there are any changes to medication for reasons such as allergies, we'll be going over that with you again at the end of the day. But this is just kind of a general overview. Another thing that's in your pack is all the instructions here that we're going to go over, some of them in the video, and then the rest with you at the post-op at the end here. Also in this little pamphlet is Dr. McDonald's cell number in here as well. Right, so what are we going to do tonight? Really, all we want you to be worrying about is being as comfortable as possible. One, having a big meal, drinking lots of fluids, and then staying ahead of the pain with your Tylenol 3. So you can take 1 to 2 tablets every 4 to 6 hours, but make sure you have something in your stomach first. I would say as soon as you can, then take your 2 T3, and you're also, if you have the antibiotic, you're going to be taking 1 antibiotic with that as well. Now, the other thing that's going to be expected of you today, this is your homework, is spraying. Now, probably easier to remember if you can spray about, a few spritz every hour tonight. So just like so, and that's good. You don't have to stay up all night trying to spray either. So just as long as you have some good moisture in that area, that'll help keep it clean. It'll help soften the scabs that'll be forming and make it easier for you down the road when you have to clean it. So you don't have to be so vigorous in the end. The other thing that you're going to want to do is keeping this area, the sutures, kind of protected so that you're not putting pressure on it because it's going to be tender. So one of those things that you can do is just have really good neck support here so that you can actually recline back and not have to kind of tense up and hold that and protect that area. The other reason for kind of being in that position is gravity. If we did a lot in the front here, you're going to have a lot of fluid. So when you're leaning back and you're reclined, gravity is going to help pull some of that fluid away from kind of settling between your eyes. Another kind of aspect to that is the headband. So what the headband has, here's some powder stuff in the corner. You can kind of spread it out, put it under warm water, and in about a minute, it's an ice pack for you. And you can throw this back in the freezer as many times as you need to kind of reuse this. So the icing will be going just over your forehead here and over above the eyebrows. And unfortunately, you're going to have to tie some of the headband just above the sutures, but you don't have to make it super tight, just enough to keep that pressure on so that the fluid doesn't trickle down. Now, in combination with gravity, you're leaning back, plus the pressure, you're already doing quite a bit to keep that swelling down. Another thing that you can do for the swelling, you can start this the next day, so day 1, which is the day after surgery, with the either 2 fingers or 3, and you can start in the middle here. And now you have to be very vigorous. If you're just doing soft massage like this on the surface, you're not doing anything. What we want to do is move that fluid that's underneath the tissue. So you have to be very vigorous. You have to push with your head forward and push with your fingers back towards your head as hard as you can. Now, you're going to stay about 1 finger to 2 finger lengths away from the grafted area. Obviously, you don't want to go in and, dislodge all the grafts. So you're going to start in the center, and you're noticing I'm going to grip my teeth here, and I'm going to push up and out, kind of making a T. So up and out, and I want all that fluid from here to kind of be pushed into the sides here. We have no drainage in the middle, so we want to kind of keep it out on the sides. Now, in combination with gravity and your headband, you should have no issues with swelling. What we want to avoid is that fluid from coming in between your eyes and causing black eyes, or worse, maybe getting them to swell up and close. It's rare, but if you stay ahead of it like the massaging, the medication, and the headband, you should have no issues. Okay, now you have to be very careful tonight about not bumping your head. For some reason, it's difficult to judge distance sometimes when you had all that freezing and it's been a long day, you're kind of woozy, tired. So take extra caution when you're getting in and out of your vehicle. Having your hand on the door frame and really exaggerating getting in and out should save you any problems. We don't want you to bump your head and dislodge some of the graphs. Also, when you're home and opening cupboards, you want to make sure that you're not directly under and you're not going to hit anything and disrupting any of the graphs. So that's really the only thing that's really odd about the first night. For some reason, it is hard to judge distance, so just take that precaution. One other thing that we get a lot of questions about is, can I get a haircut? When can I get a haircut? Can I start working out? Can I do this? And when is the time frame? For most things, your best time frame is 10 days. After 10 days, you can get your haircut, especially if you've gotten your sutures out in that 10 days time frame. You can go get your haircut. You can start with your normal routines. You can go back to swimming, that kind of stuff. The only difference is with a helmet. So if you're playing hockey, you're going skiing, or you have a motorbike or something that requires a helmet, we would ask that you wait for about a month. Otherwise, for most things, 10 days is your best time frame. You've healed enough that you should be okay with back to normal activities. There may be a few differences in terms of medications or something, but again, we'll be going over that in detail as it pertains to each individual.